About 50% of all adults will be diagnosed with a life-threatening cancer in their lifetime. So it really proves that cancer is something that touches all of us, either personally or because someone we know or love has been touched by cancer. The American Cancer Society is very proud to be a trusted source of cancer information for cancer patients, for caregivers, for their doctors, for policymakers, and for the general public. And when we can collect statistics that help inform decisions about cancer, we feel like we've done a great service for the constituents that we serve. We're looking for things that might allow us to do things maybe a little bit differently to improve cancer outcomes, either at the national level or at the state level. Over the next 20 years, we could see a doubling of the cancer rates in minority populations. And at the American Cancer Society, we think that's a huge problem. We've got to figure out how to address that. We know that access to health care plays a big role. We know that socioeconomic status plays a big role. We also know that diet and nutrition plays a big role. What we have to figure out is to what extent these are really causing these disparities. Well, the American Cancer Society wants people to know that they can do a lot to reduce their risk of cancer. They can stop smoking, for one thing. If they smoke, that is the #1 thing they can do to reduce their risk of cancer. They should also pay attention to what they eat and how much they exercise. Those are also contributing factors to cancer. And they got to make sure that they're getting their cancer screening and talking to their doctor about when it's appropriate for them to be getting those screenings. If they can do those 3 things, they're going to be doing a lot to reduce their risk of cancer.